All right. I would like to shift our focus a little bit to public health infrastructure and preparedness, which is not a technology in and of itself, but does require the development and dissemination of knowledge and innovation in a range of settings. And to really be effective, must consider some important key themes, including the role of global governance, building public trust, as we've just discussed, and ethics. As a global population, we will continue to be confronted by old and emerging pathogens, dengue fever, meningococcal disease, avian influenza, and of course our current issues with H1N1 that challenge our public health infrastructure despite technological advances. H1N1 does provide a nice platform to consider some of the progress and challenges we have made. It was first detected in March 2009 in Mexico and is now, there are now 400,000 cases reported from more than 200 countries, 13,000 deaths, which is likely an underestimate due to missed cases from uneven distribution of surveillance networks and diagnostic capabilities. Our response thus far has really been based upon this idea of a public health infrastructure that starts with surveillance and is continually reinforced by communication and evaluation to ensure our ability to respond to evolving situations. And the system would not work without people, money, technology, and of course leadership. And while this is quite a bit to coordinate, it is also embedded in an even more complex framework for population health. Individuals have their own disease susceptibility, but they are also part of a community that affects not only their exposures, but values and cultural norms that may influence response to public health measures. And of course, all of this is embedded in a political system that defines infrastructure and policies. But we have come quite a long way from Typhoid Mary, one of the first well-described outbreak investigations. Of course, more recently, our experience with SARS and avian influenza has helped us greatly improve surveillance practices, but has also really emphasized the global threat of emerging pathogens. What outcome of these earlier experience has been the establishment of a global framework to help guide and coordinate the response to infectious public health threats from the World Health Organization. The mission really is to prevent, protect against, and to control and provide public health response to international spread of disease, and it requires notification of public health emergencies and is legally binding. The Global Alert and Response Network is designed to facilitate sharing of resources, provide standard approaches for preparedness and response to build capacity, and certainly the nature of infectious diseases necessitates global leadership framework. But we can ask how such a large organization can effectively coordinate these goals for countries and of diverse priorities and needs. There are global surveillance networks, but improving capacity for local surveillance is an equally important innovation to consider. At Penn, we are using health IT and mapping to better capture some small area variation, community-level risk factors, and to model transmission. And there are exciting innovations in the use of IT, such as mobile phones and the internet, among local populations to perform both real-time and syndromic surveillance. And this detailed community-level information is key in really defining appropriate and effective prevention and control measures. For influenza, we know hand washing and masks are effective, but public health authorities and governments are also confronted with decisions about approaches such as social distancing. And it is not clear, based upon our current knowledge, how effective some of these measures are, yet we need to be able to answer these questions as we are asking individuals to potentially give up rights for freedom of movement, et cetera. Community-level surveillance can provide information to inform these types of approaches. Our epidemiologic information also helps us answer important questions regarding treatment. Who should receive treatment and when? Who should get prophylaxis? Who needs to come into a clinic or hospital? Who should stay home? Yet even with the availability of all this information, there are still many questions from supposedly informed providers, frontline providers, and the public, which underlines the importance of clear communication. Communication, as Art has discussed, is equally important in our experience with vaccines. Not only did we have issues with supply and distribution, but there was a lot of confusion about recommendations, and we are, of course, confronting increased skepticism towards vaccines in general. And we really are addressing public health emergencies in a time where there is less trust in the medical and public health system. As we take these steps to develop and disseminate technology towards public health infrastructure, we cannot forget the context and implications of our policies. Another innovation, our vaccine mandates. Our hospital imposed one this year. We had 9 people, mostly from the custodial staff, lose their job over a decision not to vaccinate, and some may question the justice of this approach. We also have ethical considerations in terms of equitable distribution of resources. There is clearly wide variation in per capita health expenditures, uneven development of infrastructure, and conflicting public health priorities across nations and communities, yet we are interdependent. And even with a global infrastructure, we need to consider who's going to make the necessary investments to build capacity and keep knowledge coming. With leadership, knowledge, and collaboration, we need to strengthen our capacities to establish infrastructure locally, nationally, and internationally before the heat of the moment so that we can really adapt to emerging situations and address issues of global governance, public trust, and ethics. And key issues that I'm looking forward to investigate with you during discussion are the role of global governance in public health preparedness, how we can better involve the public in surveillance in advance of a threat, how we can use public health messaging to address some of the public trust issues we're confronting, and of course, ethical implications for our public health policies. Thank you.